All right, I've been seeing lots of questions online about perimenopause. How does it affect hormones? All these questions.
Mhm.
So I've brought Kina. And Kina, why don't you tell us why people should listen to you? Why do you know what you're talking about when it comes to perimenopause and hormones in general?
Okay, good question. Why should you listen to me? There's a lot of good voices out there, so you have a lot of options. One of the things that we're working with is a wide range of women and men, but we're going to focus on women right now with perimenopause. And I come from actually a background of health and wellness. So I've worked with a wide range of females in a wide range of ages. But in the past 10 years, I actually am a nurse practitioner and I have spent time in the emergency room, in home health care, in a various amount of different things. But my passion has always been more of the functional health, and it's been a really solid focus on the fact that your body is made to be healthy, it's made to be well, and we go through phases in our life where we think we're not doing well, but it's only because we're going through changes. So you can ask a 12-year-old girl that might be going into, menarche and thinking, what's wrong with me? I'm broken. No, she's just shifting into a new phase of her existence here. Same
Yeah.
thing with perimenopause. We're shifting into a new phase. We've gone from the phase of where we are fertile and we're going to, whether we have children or not, our body thinks that that's what we're here to do. So once we hit this place where our body says, we're not doing that anymore, my focus has been on identifying all of the foundational issues that could be causing perimenopausal symptoms and then helping women figure out how best to manage that phase in their life of transition because it can be a long one. So I've done a lot of education. I've done a lot of functional preparation, and I've worked with a lot of patients in a wide range of spaces in their lives to be able to have a better understanding of where people are coming from. And it helps that I'm also in my 50s. So I'm
Yeah.
kind of in that same space. So I have a lot more empathy, sympathy, understanding, and curiosity because I'm researching and learning and attending seminars and reading books and all that because I want to be able to help people to be able to age as well as they can, women especially, because, that's something that I am personally. So I
And
definitely
they're
have
more complex than men. Men age.
they they can be, that's for
Yeah.
sure. So, but yeah, so it's a passion of mine because I feel like women deserve to have the last sometimes 40 or 50 years of their life, either perimenopausal or menopausal. We deserve to have that be some of the best years of our life. And if we do this properly, we can be. It can be the best years of your life. Absolutely.
Awesome. I'm glad you said that 'cause you're giving so many people hope because they're scared going into this. One of the biggest questions I get asked is what are the signs of perimenopause and kind of how long does it last? How early can it start? Can you just speak to that for a little bit?
Yeah, absolutely. Perimenopause is an interesting space because you can't really test it. There is not a defined time. It's not like, okay, it's going to be 3 years, 6 months, and 10 days, and then you're done. There is no defined start, really. And there's no defined end, except for some reason, they've come up with as soon as you are 12 months without any period, zero bleeding, you are defined as menopausal. But man alive, think about it. If a woman has gone 11 months, not one cycle, not one drop of blood, and then she has a cycle, she is starting over. It's like Monopoly, go back to start over. So there's really not a defined space for perimenopause, but in general, it's typically for most women 40s and 50s. The average age of menopause is around 52, 53. So some women start in their 40s and hit that, and other women won't hit a full, documented medical menopause until even in their late 50s. So it is a very wide range, a very soft space of who
Yeah.
knows
Have
what's what there.
have you noticed women younger and younger? Like sometimes at our clinic anyways, we get calls and people are like they're in their 30s and they're freaking out. They're like, I think I'm having hormone issues. What's going on?
Oh,
So
100%.
yeah, how
Yeah.
and then they feel like there's something wrong with them because I'm too young. That's their next thing they say.
Yeah. Yeah. It's scary. I mean, these are women that are still raising young children, and then they're feeling like they're hitting this space of, a time in their lives where that should be reserved for old people. That should
Yeah.
not be them, right? But we are also finding, and I know a lot of it has to do with the garbage in our food, in our environment, the stressors, the toxins. We have a lot of endocrinological disruptors going on. This is all really shifting how women are um, flowing through their cycles. Enjoy that pun, flowing through their cycles. But I mean, it really is shifting. Girls are starting their cycles younger. And so a lot of times women are also coming into menopause and perimenopause younger, but it's not necessarily a good thing. It's just that there are so many more endocrine disruptors going on, and unhealthy lifestyles and obesity and stress. And so a lot of this is there's, like I said, there's not a defined space for this, but I agree with you. Women are starting to experience perimenopausal symptoms younger, but I don't always believe that it's perimenopause. I think they are just dealing with some hormone dysfunctions. And once we get underlying issues resolved and we get them into a more optimal space of health, their hormones balance out and they don't need to have as much care in that direction.
So did I hear you right? It People think they're in perimenopause. Not everyone, often,
Mhm.
but
Yeah.
really they're just having hormonal issues. And having hormonal issues doesn't
Mhm.
necessarily mean you're in perimenopause. And those hormonal issues can be balanced and fixed. Is that what I'm hearing you say?
Yeah. Yeah. So I'm not saying that's across the board, but if I
Yeah.
were to have a, say, young 30s, early to mid 30s patient with symptoms that kind of sound similar to perimenopause, I would not immediately jump to perimenopause. I would want to conduct a thorough panel of, labs and a history and what were your childhood stressors, adverse child, ACEs is what they're called, adverse childhood experiences. What's your lifestyle like now? What's your cycle been like? Because sometimes what could be mistaken as perimenopause can just be that we have foundational suboptimal systems functioning, and hormones are obviously going to be affected by that. So we don't always jump to your hormones are messed up. We need to fix those. It can be, hey, your adrenals are tired, which by the way are hormones, but like
Yeah,
not the
yeah, yeah.
traditional, like,
Yeah.
so yes,
People
your
think,
hormones are messed
yeah,
up.
they think of the top three hormones, but
Yeah,
and they don't realize
exactly.
adrenals and insulin are also
You got
hormones,
it.
right?
Hormones. So we're looking at the whole person. We're not just looking at a set of hormones. We're looking at a human being who has a lot of various systems that need attention.
I think what you just said is going to give a lot of people hope.
Yeah, I hope so, because there is hope. We live in
Yeah.
a glorious age. Our poor moms, grandmothers, great grandmothers, no thanks. They didn't have all the great stuff we have now. But also they didn't have all of the awful food and the different lifestyles that we're all managing and the stress. So, there's a give
So
and a take.
let's talk symptoms for just a minute. So those symptoms that could be confused as menopause, or they could just be under other underlying issues that could be worked on and fixed and get better. What are those common symptoms that people come in for that they say, I think I'm in perimenopause?
Right. A couple of them. Fatigue is a big one. Like across the board, I'd say one of the top things I see is fatigue. Another one is difficulty losing weight. So fat, fatigued is are two of them. Stress is a big one. Low libido, where they think, oh, my hormones are all messy, and so I just have no interest in sex. Whereas it could be a host of other things involved there. And their cycles could be a little bit uneven or wonky. And that can make them think that maybe that's a problem. So, I mean, these are things that, yes, those can be perimenopausal symptoms, but they can also be a host of other things. So, we don't want to rule out anything immediately.
Okay. So don't jump straight to menopause, and
Mhm.
even don't jump straight to hormone balancing.
Yeah,
Okay, so you
yeah.
mentioned stressors a couple times, or stress.
Hmm.
There's different kinds of stress. Are we talking, oh, I just have a really hard job at work,
Yeah.
or what do you mean when you say stress?
Good question. You have a lot of different types of stressors. So, yes, you have emotional stress, you have environmental stress, you have physical stress. You have spiritual stress, relationships. What are you eating? Like there's so much coming at us that it's not just one trigger or one stressor. And that's why, like I kind of keep saying this, we look at the whole person. We look at the entire person and what they've got going on in all of their life, not just at a lab. Labs are important and we want to test and not guess, but we also want to be able to understand what's driving this person, what's really kind of squeezing down on them a little bit.
Okay, cool. I just have a couple more little things I want to ask you, and then I'm going to give you the floor to like teach these people. What do I do if I because people who find this
Yeah.
video, they're scared, they're wondering,
Mm,
and then I'm
yeah.
going to give you a second to talk to that. But there's a couple questions people have asked and want to hear the answer to. Can I get pregnant during perimenopause?
Sure.
Okay.
Yeah.
And brain fog, is that part of it?
Yeah. Oh, 100%. Brain fog is a indicator of a underlying problem. So brain fog can be a response to hormone imbalances, but it can be a response to a lot of other things. So we put them all into our differential diagnoses and we say, hey, this could be causing this brain fog. This could be causing this brain fog. And then we start looking around and sleuthing and really, getting to the bottom of it. But yeah, brain fog it's a big one for people.
So now I'm going to give you your last question and your speak your piece time. This is where you get to kind of wrap it up for people and give them some advice. Um, People are going to be wondering, what can I do naturally? What can I do? What does hormone? Should I be afraid of hormones? There's lots of questions here, like,
Oh, yeah.
what if I have a history of cancer? Can I take hormone therapy? Or how do
Yeah.
I treat this? Can exercise alleviate this? Can changing my lifestyle and habits alleviate this, or do I need to do both, or what supplements, or there's a ton of questions on my page about stuff like that. So I'm just going to say, uh, give people some options on what they should do and speak your piece, and then we'll wrap this up.
You got it. So I teach, hopefully, every patient that I meet with, if we get the time to do it, about the 4 pillars of health because they are foundational. So before I recommend medications or hormones or supplements, there are 4 foundations that have to be in alignment for you to really be able to have the success to age well and manage the transition from perimenopause, menopause, all of that. So you've got to have good nutrition. And that means that you're not eating out all the time. It doesn't mean you don't eat out. There's balance. But that you're eating whole foods. You're eating enough protein, especially protein. Women need protein, and we typically don't get enough. So nutrition, big one. The next one is exercise. We need to exercise. And women need, well, everyone does, but women need to do strength training. And not enough of them do. They think it's going to make them big and bulky. And I just reassure every woman I work with, listen, unless you're really working to get big and bulky and doing extra stuff on the side, believe me, it's not going to happen. But muscle is the fountain of youth. So if you are not lifting weights, if you are not spending the time to maintain your muscle, you are not going to age well. And you're not going to make it through this transition as well as you could have. The other one is sleep. We need sleep, and women need more than men. We need at least 8 to 9 hours a night, and it needs to be quality sleep. And I know that can be a difficult one because when women do go through perimenopause, menopause, and the hormones are shifting around, sleep can be very difficult to achieve. So we work on that. But sleep is a pillar. So I've got the 4 pillars, and the fourth one is stress management. So if we're stressed, nothing ain't working because our body is releasing cortisol. We are in a constantly inflamed state. We're breaking down muscle. We're breaking down tissue. We're going to have extra high fasting insulin levels. We're going to be in a state of disrepair. So stress management is a big deal. And so I encourage every one of my patients, and some of them do and some of them don't, but I tell them, wake up earlier than you normally would, get your exercise in, take a cold shower, do some breathing exercises. I'm a fan of Wim Hof breathing, but there's a lot of good stuff out there. And meditate because meditation helps to calm our nervous system. And when our central nervous system is in a nice, easy, parasympathetic, easygoing state, everything in our body works better. So those are the 4 pillars. And if you don't have those 4 pillars in place, anything else that we do to help will maybe help, but it will be less effective. Plus, I think it's really important for people to take ownership of their health. Don't leave it in the hands of a medical, I'm going to put in quotes here, professional. There's a reason why the term practicing medicine, we don't do medicine, we practice it, which means it's not ever mastered. And every person is their own unique universe, which means what worked great for the last patient may not work as well for you. So we have to be willing, as patients ourselves, to take control of our health. That means no one's forcing you to drive to the McDonald's and buy the burger and fries and soda. Like that's you doing that. And it doesn't mean that you can't do that, but do it very infrequently and based on whole foods and good enough protein and eating healthy fats and all that kind of stuff. So take responsibility. That's a big deal. And I have patients come to me and complain about a previous provider and, oh, they did this and they didn't do that. And I'm like, listen, you're the one in charge. So it doesn't mean that your provider isn't responsible to do the right things for you, but it's a partnership. So I like my patients to know, listen, you're in the driver's seat. I'm in the passenger seat. I have a map and I'm just going to tell you, hey, let's turn right here. But if you tell me turning right actually isn't going to work for me, then let's go straight and let's see what we find there. So it's a partnership, and that's important for patients to know. So with those 4 pillars in place, we can then start to get into the really good, deeper stuff. And that requires that we test. So I really love to do blood work. I like to get a really comprehensive panel that looks at a full profile of, your hormones and your fasting insulin and your lipids and what are your adrenals doing? Because those are so magnificently key to things. And how are, like there's just a lot to go on there. And once we get that started, then we can go down the rabbit hole of, okay, what else do we need? Okay, what else are we over here? Do we need to do a test here? But really, there's hope because you're in charge. You can control these 4 pillars. Even if your life is absolutely chaos, you can still make baby changes. If you're not eating any vegetables right now, well, then first thing in the morning, eat a vegetable. Now you can mark that off of your list. Congratulations, you started your day well.
Yeah.
Whatever it is, there's got to be tiny little baby steps that put you in charge. Then you, with your provider, as a team, can move forward to be able to identify, oh, I have no estrogen. My testosterone's in the tank. Oh, I have insulin resistance. Oh, my adrenals are shot. Whatever it is, then we can start to heal those things because we have a solid foundation to do that. So that's kind of the path that we like to take. And it's different for every person, but there is a basic process. And then, we go off from there. I hope I answered that question. I'm not even
Yeah,
sure
it's
if I
awesome.
went off on a tangent.
Awesome. This is going to help so many people. The last thing I want to ask you, and just speak to it just briefly because I know you can't. You're not going to
Yeah.
down talk it. Everyone has that doctor. Not everyone, but so many times the question. My doctor just tells me they won't. Sometimes their doctor won't even run the blood tests. They just say, "Well, this is the phase of life you're in. Accept it. Everything's normal for your age."
Yep.
What do you say to that person? What they're
mhm.
not here. They're not here with you in Utah. They can't
Yeah.
be your patient because I'm sure everyone's going to see this and they're going to want to be your patient. But what do you say to the people that find this video and they're in that situation? They don't know what to do.
Yeah, that's a good question. And I actually have had a lot of patients in that situation, and I really feel for them because it's empowering and it's discouraging. And that's the last thing they need. They already feel that way. That's why they're going to the doctor in the first place.
Yeah.
Number one, you're going to find a new doctor. And there are lots of great medical providers out there that are on this path, that are up to date on the
Yeah.
research.
How do I
I had a
identify them?
patient just last night do that. Yes.
How do I
So
identify
look
those?
Yeah, look for them. You're going to look for things like functional medicine, integrated. There's kind of keywords that you're going to find. If you're just going to a family doctor, that's an allopathic doctor that sees, one patient every 15 minutes in their medicine, they're basically a legal drug dealer, is what they are. They've been trained by the pharmaceutical companies and they say, oh, you have high cholesterol. I'll give you this drug. Oh, you have diabetes. I give you this drug. Like where it's just a straightforward, I do what I was taught and I don't look outside the box. If that's not your style, there are so many great functional or integrative types of medical providers out there. I'm a nurse practitioner. And I happen to be a little bit fond of the nurse practitioner genre, if you want to call it that, because I think we are a little bit more open to seeing things outside of a rigid box. There is amazing research that has been conducted showing how safe and beneficial hormone replacement therapy is. And when I say hormone replacement therapy, I mean bioidentical. So we are not using the synthetic fake junk that has really caused most of the problems that these old school doctors refer to. I literally had a patient last night that told me her doctor told her she has to stop taking all of those cancer causing hormones that we had, safely placed her on. And I told her, I just said, well, you can follow what he has to say, or you can go ahead and just do 5 minutes of research on your own and realize that he probably hasn't even looked at anything in 20 years since the Women's Health Initiative. So you can search anywhere in, well, I don't know about the world, I would think, but definitely in the United States. I don't care where you live. You can find a provider that is educated on this and is safe and can take good care of you. So don't lose hope.
Awesome.
We're out there.
Thank you, Kina, so much. I appreciate your time on
Welcome.
this.
Yep, my pleasure.